Welcome, everyone, to the Mental and Behavioral Health Finalist Spotlight session of the 7th Annual Digital Health Awards. I'm thrilled to be joined by Dr. Stephen Klasko, our executive producer and former CEO at Jefferson Health, and Solome Tibebu, founder and CEO of Behavioral Health Tech. Today, you'll hear directly from the standout finalists in this important category, companies shaping the future of healthcare across the globe. I'm Bethany Boschert, show director of the Digital Health Hub Awards, and I'm excited to welcome you. This is my 4th year with the Digital Health Hub Foundation, and it's been amazing to watch how quickly the digital health space continues to evolve. At Digital Health Hub, we're here to celebrate the innovators shaping the future of healthcare, like you. Thank you for joining us. I just want to take a quick moment to introduce the Digital Health Hub Foundation, a 501c3 nonprofit behind today's session and the annual awards. Founded in 2017 at UCSF with a mission to help the world's best digital health startups grow, scale, and succeed. Today, our community includes over 30,000 innovators, from early stage founders to industry leaders, investors, payers, and providers. Throughout the year, we run educational programming, network events, and thought leadership series, all leading up to the biggest moment, the Digital Health Awards at Health in Las Vegas, where we celebrate companies truly transforming healthcare. We're proud to shine a light on this ecosystem and grateful to all of you for being part of it. So congratulations to our 2025 finalists in this category. Your innovation, passion, and impact are helping to shape the future of digital health, and we're proud to recognize your work on this global stage. I am going to introduce Jason Saltzman, Head of Insights at CV Insights. Jason, all yours.
Hi, nice to meet you. I'm head of insights at CV Insights, as Bethany just introduced. CV Insights is a predictive intelligence company primarily focused on private companies and private markets. We will be the intelligence provider at Health in 2 weeks now. And a lot of the work that we've done with Bethany and the HLTH team has been around, sort of mapping out the spaces that will be most topical, most important, and have seen most interest in the digital health space. With that, might jump into a few notes on sort of the state of mental and behavioral health. Very happy to talk with anyone about what it is that we do, how we take sort of exhaustive data on all of the relationships and the companies building in a given sector to map out the space and provide, leading biopharma companies, leading VCs, leading innovators with, the most up-to-date, the most predictive information and intelligence on what's happening in the sectors that matter most to them. With that, we'll jump into the mental and behavioral health space. Right, as you can sort of see, I'll give the caveat that largely for any graph I pull up that looks like this, everyone has to ignore 2021 and all of the end of the ZERP era, a lot of capital that came in there. But what we can see is that as we look at 2025 and we look at 2024, we're seeing a nice rebound from the lulls and sort of the VC winter that happened in 2023 in the mental and behavioral health space. Right, we've seen $5.7 billion in deals to the space in the last 18 to 20 months. And we're already seeing, and it was already sort of a mature market dominated by a handful of well-capitalized platforms, many of which were funded in the sort of post-COVID or during COVID VC flood of capital era. And many of them are really tackling three critical challenges, which are access, outcomes, and enterprise adoption across the mental and behavioral health space. And what we're seeing is leaders like Spring Health and Lyra and BetterHelp get to the point where they're not really just focused on the general telemedicine, telehealth space, but really getting to the point where they're really driving on that access, outcomes, and enterprise adoption. And those are sort of the established players. What we're looking at now is where the emerging players are coming out, and we see that AI in particular has really opened a lot in terms of personalization across specific markets, looking at the perinatal mental health market, the behavioral addiction market, senior living, and sort of digitalizing the experiences that a lot of the senior community are going through, and then the online psychiatry. And we've seen not a recent flood of capital. I missed a time frame on this 121 million plus, but that is within this year alone, going into what we call specifically very niche verticals, offering sort of increasingly personalized care across mental and behavioral health. We're seeing that the AI is behind a lot of this personalization, but it also is driving innovation across assessment, safety, and sort of matching. When you look at providing clinicians and care providers, we see that there's a ton of opportunity in sort of the predictive intervention, hybrid models between digital and sort of clinician-based care, and then the blurring lines or sort of crossover between clinical and consumer products. As we look to sort of where the future is and where we see the most opportunity, right? We see a lot happening around again those niche verticals, those specialized domains, and access to proprietary data to fuel those AIs or the AI models and AI features, right? We also then see that largely due to the massive wave of investment in 2021, 2022, right? We're going to get to the point where there's a lot of consolidation in the space in the next 12 to 18 months. And then right now, there's still a massive amount of moat around companies who have already nailed or continue to nail the privacy and compliance requirements for mental and behavioral health. When I think what we are about to get is a lovely overview from people who are far smarter than I am on this space, around what's happening on the ground, where that innovation is really happening. And so I'll hand it back off to Bethany to introduce our lovely panelists.
Thank you, Jason. So it's my pleasure to introduce someone who brings a unique lens to this conversation, combining deep healthcare expertise with a sharp eye for transformative innovation. Solome is the founder and CEO of Behavioral Health Tech, and she's our category champion. We're honored to have her here today. Welcome, Solome. I'm gonna throw it over to you, and then when you're ready, you can throw it over to Stephen Klasko.
Thanks so much, Bethany, and thank you for all of the work and details that has gone into bringing this to life. I'm not sure if the finalists here have seen how detail-oriented this entire process has been, but I can really appreciate it now being in the event space. But hi, everyone. I'm Solome Tibebu, the founder of Behavioral Health Tech, and have had the great pleasure of getting to know many of you. Thank you for being part of our community. But for those who are unfamiliar, BHT is an annual event and community bringing together payers, providers, startups, investors, funders, policymakers, and on and on. And I would just echo a lot of the things that Jason was saying, just seeing a lot of exactly that happening with the companies that we showcase at the event and year round, and excited to meet a lot of you in person. And I think now Dr. Klasko has joined us, so maybe I'll give you an opportunity to introduce yourself before we ask our one question to all of our participants here.
Thank you. I'm Steve Klasko. I'm an obstetrician. I will also be DJing the HLTH Health Hub Awards in Chica on October 20th. So just want to do that ad for Digital Health Hub. But more recently, I've been the dean of 2 different medical colleges and the CEO of 2 academic medical centers. Most recently, Thomas Jefferson University and Jefferson Health, which became an 18-hospital, 2-campus university. I had written a book with Hemant Taneja called Unhealthcare, a Manifesto for Health Assurance. And then went over to that side, and I've been involved in the mental health and behavioral health world in several different fashions. We started the largest integrative brain health entity funded by Bernie Marcus at Jefferson, called the Marcus Center for Integrative Health. I've been involved from the beginning with companies like Neuroflow as a predictive model, and Ellipsis using voice biomarker technologies. And I think most recently, I've been trying to look at, and I think you mentioned it, you've all mentioned it, the good, the bad, and the ugly of AI really comes together in behavioral health. My new book is called Swifties, Startups, and the Singularity, where I come back from 2035 as the Chief Digital Health Officer for President Taylor Swift. And our healthcare motto is make healthcare tailored and make it swift, neither of which is true in 2025. And there's no place where that's more true than behavioral health. So I hope as we listen to your stories, you'll be telling me how when I am there in 2035, you have made behavioral health tailored and swift, especially for the 60% of people in this country that can't get the behavioral health resources they need. So thank you, Solome.
I am so glad I went before you. That is phenomenal. Thank you. Amazing. If you could just give your 60-second, who are you and what do you do? Others, judges will be able to see this video, so important to say that as succinctly as possible and what you would like them to take away from your business. Okay, so how shall we do this?
Maybe start at the top with company, Solome.
Let's go down the list. I like people that get the opportunity to volunteer, but that might be too chaotic. So Shailja, you're first on our list here. So maybe did we get you to, there she is. Okay.
Hello, everyone. Thank you for inviting us here. My name is Shalja Dixit. I'm a physician, but more importantly, I actually suffered postpartum depression when I was going through my own journey. That's what motivated me to form Curio after spending a lot of time on the payer side and pharma side. What we do, we actually address with our digital first, AI first approach, women's mental health in every stage of their life. But the first one that we started with is postpartum depression or perinatal mood disorder in a broader category. We are the first and only one who got FDA clearance in this category last year, 510K clearance to get to treat postpartum depression and anxiety, mild to moderate. And now we are moving on to actually fertility and perimenopause, menopause. So the way we approach it, the first thing is we have made a predictive tool. So when you go to OB offices, the first challenge is identifying these women early on. So our predictive tool is able to identify a woman as early as second trimester who will end up having postpartum depression. We work with claims data, with health plans. We have coverage with health plans. So 3 health plans are covering us after our FDA approval, and we have launched in 3 states as of today. The second thing that we do once we identify, we outreach, we put them on our digital platform, which is FDA approved with 83% efficacy. We have published the peer-reviewed JMIR article, which is available in open source, and anybody can review that. We have been able to demonstrate 83% efficacy. It's an 8-week module. Think about this as a therapist in a box, but we are not taking the human from the loop. So there's always a human as well. So, everything is supervised by a trained therapist, and we partner with trained therapists in 22 states as of today. So that's our model. And hopefully woman feels better. We are able to show efficacy using Edinburgh Postpartum Depression Scale, which is used in clinical practice as well. As I said, our next one is we are working on
I'm
fertility.
so sorry.
We are going to go through FDA pathway for that as well.
Sorry, everyone. I forgot I had to mention I have started my, you can't see it. Just like last year, I've got my stopwatch. So if I interrupt, really excellent work, Shailja, all that you've accomplished. And I know it's a lot to cram into 60 seconds, but okay. Dana, if you want to go next, we'll give you 60 seconds. You can get started now.
Hi, I'm Dana Klein. I'm the co-founder and CEO of George, a mental health and wellness app for kids between 7 and 12, addressing the 5 top mental health issues: anxiety, depression, OCD, ADHD, and autism issues. We leverage AI with evidence-based therapy, CBT, ACT, and positive psychology, and put them in the form of friendly characters that engage the children in interactive activities. And with real-time monitoring. So we basically build a cocoon around the child, real-time monitoring on the parent and guardian side, as well as the clinician and a therapist or social service involved. And And that's us in a real nutshell, but our differentiators are the real-time monitoring, the 3 therapies, the top 5 mental health issues. We use white hat technology, so we're not addictive, and the age group is underserved and preventative in nature, and we definitely want to get them before they're teenagers. So that's us.
Awesome. With 3 seconds to go. Wonderful. Congratulations on all of your great work. Okay, let's see. Kazu, Universal Brain?
Yep. I'm ready. Hi, I'm Kazu Okuda, and CEO, founder of Universal Brain. I'm a physician entrepreneur with hands-on experience in psychiatry. And then, importantly, my father suffered from depression, which is one of my inspiration for Universal Brain. And our mission is simple. We bring objective brain data into mental health treatment. Today, psychiatry still depends mainly on patient-reported symptoms, leading doctors to choose medication on TMS or esketamine by trial and error. We changed that by measuring brain function directly using EEG-based event-related potential, or it's called ERP, millisecond level, or brain signal that reflects broad cognitive control. So we enable physicians to monitor patient's brain function, and then enabling physician to select the best treatment option for the patient based on brain function. Thank you.
Fantastic. Okay, next, Patrick, Somethings.
Awesome. Hi, everyone. My name is Patrick Gilligan. I'm the founder and CEO of Somethings. Somethings is the mental health platform for the digitally native generation, i.e. our teenagers, where we make it effortless for teenagers to build genuine, real human connection with certified peer specialist mentors to help every teen feel their best. We're doing for mental health for teens what Duolingo did to language learning, turning something that felt scary and daunting and making it feel fun and approachable. Our mentors are powered by a suite of AI tools to help them amplify their ability to build genuine human connection with their teens at scale. And we're launching our first study this fall, where we demonstrated that teens who use the Somethings platform for 75 days or more see a roughly equivalent reduction in mental health symptoms as compared to a traditional clinical intervention. And we are live with a statewide partnership in North Carolina with the North Carolina Department of Health and Human Services, and scaling quickly across more states. Thank you.
Amazing. Perfect timing too. Really impressive, everyone. Okay, next I've got, let's see, Ali Kwema.
My name's Ali Jabri. I'm the CEO and co-founder of Kwema. We're on a mission to make feeling safe the foundation of mental and behavioral healthcare. Every hour, 2 nurses are assaulted. This is such a problem. It's even higher in behavioral health. So what we did is we took something that a nurse or a healthcare worker would wear in any scenario, like this badge. We put a button on the badge reel itself, so you'll always have it on you. And when you need it, you press the button discreetly. It then sends your exact location to your supervisor, to the police, or to your security team, depending where you're giving care. This works in clinics, on the go, and at patients' home, which is where the future of healthcare is going. By blending our technology with empathy, we're helping hospitals and systems go beyond compliance and build a culture of psychological safety, where caregivers feel as supported as the patients they serve. Our differentiation is that we're compatible with any Wi-Fi network. We're effective, where in just 3 months, we increase psychological safety by 50%, and we guarantee adaptability and compliance because there's no behavior change. Everybody already wears one of these things. So replacing it for a dumb badge reel with our smart badge reel, you have coverage overnight. Thank you.
Amazing. Diana, parallel learning.
Hi, everyone. I'm Diana, founder and CEO of Parallel Learning. We are expanding access to special ed and behavioral health services, specifically for K-12 students. We are a fully virtual tech-enabled solution. And most importantly, I'll note that I started the company based on my own experience. I have dyslexia and ADHD myself. Today, 1 in 5 students in the US are diagnosed with a learning or thinking challenge. Many go undiagnosed, and districts simply cannot keep up. They have a $90 billion budget to spend, but school psychologists are very much in short supply. It is very clear that the solution to solve this access barrier must be virtual. And we've essentially helped close this gap by building Parallel, which connects schools with over now 400 licensed clinicians who deliver everything from psychoeducational assessments to counseling services, all via our proprietary technology platform. The platform itself is very core to what we do. 98% of students meet or exceed their goals or IEP goals using Parallel. And we have a 90%, over 90% student satisfaction using the platform, which is really aimed at collecting real-time data towards IEP goal progress, compliance, or pushing for student engagement and creating a continuous feedback loop between providers and clinicians.
Amazing. Thanks, Diana. Okay, next we have Chicho. Spring.
Hi, thank you. My name is Chicho Matthew. I'm the Chief Product Officer here at Spring Health. And Spring Health is the leading global behavioral health solution, proven to change people's lives and deliver net positive financial return for these organizations that utilize our platform. We provide a personalized, or should I say tailored, precision mental health care platform that's really affordable in helping members find the right care at the right cost through both our employers and our health plans. The good things about our platform, and what I'm really proud of, is that people get better in about half the time and half the number of sessions than our leading competitors. And we do that by leveraging both data, which is the fuel for our AI, that allows us to match individuals with the right care that they need from the very start. So whether that's digital support or coaching or therapy or medication management, we do all that by reducing trial and error. This also leads to a lot of the great outcomes that we see. We see members recover 8 weeks faster than average. We see a 2 times higher likelihood of full remission, 92% of clinical improvement after care. And most importantly, what I love is that 95% of members are very satisfied with the platform and the service that we provide. So really excited to talk about Spring Health today. Thank you.
Wonderful. Thanks so much. Okay, now we've got Nicole from Brightline.
Hi, my name is Nicole Jolovic. Pronouns are she, her, and I'm privileged to serve as the Senior Director of Bright Life Kids. So Bright Life Kids is a program built by Brightline that's transforming how families access mental health care in the state of California. So now in our second year of this truly historic partnership with the California Department of Healthcare Services and CalHope, Bright Life Kids provides free behavioral health tools, live coaching, and care navigation services to families with children under the age of 13. And that's regardless of income, insurance, or immigration status. And what makes our work different is how immediate and inclusive it is. And what I mean by that is families can connect with live coaching support in over 17 languages. On average, they can connect with a coach in less than 2 days, and they receive personalized support designed for both the children and their caregivers. Since we've launched just under 2 years ago, we've reached over 250,000 families across all 58 California counties, with the majority of our members living in under-resourced communities. And what I think is really compelling is that for the majority of the families we serve, about 3/4, Bright Life Kids is the very first time that they're accessing any kind of mental or behavioral health support for their children. So thank you all.
Thank you, Nicole. It goes by fast. Really good stuff.
Mm-hmm.
Let's see. Last but not least, I think we've got Lucia Osmine.
Awesome. Yes. Hi, everyone. I'm Lucia Huang. I'm co-founder and CEO here at Osmind. We're a software and data company, and we actually power the largest network of independent psychiatry practices in the US. And we also fuel cutting-edge research with life sciences companies that are developing new treatments. So as many of you know, psychiatry is becoming more and more complex with the advent of novel treatments like Spravato, TMS, future FDA-approved psychedelic medicine. And this actually mirrors a lot of what other specialties went through, like oncology and rheumatology, where clinical practice and insurance got a lot more complicated. So our software suite serves practices, and we leverage AI to streamline and automate a lot of these needs. And we help clinicians get to go back to focusing on practicing the best possible medicine that they can. We've helped to collect a lot of data, so actually over 4 million patient outcomes to date. And we've been able to use that to publish multiple peer-reviewed peer-reviewed papers and assist life sciences in their research and how they access new treatments. So right now, the status quo in our country is that patients on average fail, two-thirds of patients fail SSRIs. And with what we're building at Osmind, we get these patients a greater chance of accessing the innovation that they really need.
Fantastic. And I didn't see him join, but he's here. I think Stephen Smith, OCD.
Thanks, Solome. Good afternoon, everyone. My name is Stephen Smith, and I'm the co-founder and CEO of NoCD. We provide online specialty therapy for people who have obsessive compulsive disorder and related conditions above the age of 5. Started the company with my own personal experience going through the ringer with OCD, where I was misdiagnosed about 6 different times, became housebound. Fortunately, able to get to specialized treatment called exposure and response prevention, which changed my life. Ran to barriers though, accessing that specialist who did ERP, and then I ran to more barriers, getting support between sessions. And that was the catalyst for starting the company about a decade ago. And since then, we rebuilt the mental health care system for people with OCD and related conditions. So we may be one of the largest specialists today. This year, we're going to do about 900,000 online specialty therapy sessions. And we're doing, most importantly, though, great outcomes with those sessions. We're making people better, getting them healthy in a shorter amount of time than the standard of care, and then producing exceptional outcomes too on the maintenance side, where people are staying healthy then long term. And we've actually proven not only outcomes in several peer-reviewed journals, but we've also shown multiple cost savings studies, where we've shown that we could save the healthcare system, several $1,000s per person, just because we're super focused on such a high cost complexity at treatable population. And that, has caused us to really think broadly about what we want to do long term. So I know it's time.
They're really impressive, everyone. You've just by way of being here, you have so many good things to say. So great condensing it down and really impressive. I just want to make sure, did anyone else join that I didn't get to? Everyone got a turn? Okay, then let's see. And Bethany, our fearless leader.
That's great. Do you want to jump over to Stephen? He can ask a question of these companies.
Sure. And we're going to let you really hang out now and give you 90 seconds to answer a couple questions each. But one of the things that I always get concerned about with these technologies is that they don't just make the wealthy healthier, right? And which has been, I think, the story of some of the early parts of AI. So I'd love to hear a little bit about the populations you impact. And well, I started out by talking about 2035 and my role with President Taylor Swift. Tell me more immediately, what are you most looking forward to in the next actually 12 months of your business? What do you think if we're sitting here in a year, we'll say? So you can answer either or both of those, but I think those are the two things that I'm very interested in. So if somebody wants to jump in, or else I can just do the highlight square.
This is Shalja.
Great, thanks.
From Curio. For us, as you know, most of the deliveries happen in Medicaid population, and that's the population because we focus on postpartum depression and perinatal mood disorder. That's the population that does not have access to therapists. So our actually one big focus area is Medicaid population and working with states. So we have one state that we have started working with in Indiana. We want to expand to other states, but we are going to focus on Medicaid population and not just commercial population, talking from payers and state Medicaid program, just because there is the biggest unmet need that exists. And we can bridge the gap of that access, right? We can get them to the therapist, which is a digital therapist, right away. So that's one. And I think the second thing that you asked, our hope is a wider adoption. We are launching with HCA, Hospital Corporation of America, in Texas, Colorado, and Florida. And we are hoping that we can at least in next 12 months to 18 months get to minimum of 10 to 15 states by end of 18 months, serving Medicaid primarily and then commercial population as well. Thank you.
Great. Thank you. Anybody else want to jump in?
I can jump in here.
Good luck. You guys are down by one, right?
Down by one. Hopefully tonight's a better outcome.
Okay.
But so for our company, No CD, so today we have 138 million commercial lives under contract. And I emphasize commercial because we don't yet have as many Medicaid and Medicare lives under contract. It's a big area of focus for us. Next year, we are launching into another specialty. We've used the infrastructure we've created from scaling No CD today to be a springboard to helping other specialties also deliver we can scale and most important impact too. But what we're hoping for is that next year is the year that we're known for our work actually getting into Medicaid and Medicare populations, starting with Kaiser and with Medi-Cal. So we're launching in California and starting in January. We're hoping that momentum continues on, that we can really help those who are most complex receive the special care needed to really have a life-changing experience. So that's what we're hoping to, that's our goal here for 2026.
Fantastic. Who else wants to jump in?
I can jump in.
Great.
Great. Awesome. Yeah. So at Osmind, perfect. At Osmind, we serve 800 independent psychiatry practices, and these are owned by physicians and nurse practitioners, actually spanning 49 states. So sadly, all but West Virginia, but we're working on it. And so we're really across all metropolitan and rural areas. And what's really unique about these practices is that they typically serve patients who have really lost a lot of hope in their mental health care journey. Our patient populations mostly include individuals who have severe or treatment-resistant conditions. They've tried multiple lines of treatment. They have ongoing polypharmacy, chronic illness. And so that's the area that we really hope to serve that can drive down costs in the system and improve patient outcomes overall. And that kind of relates to what I'm really excited about in the next 12 months is that despite that all sounding quite dire, there's actually a lot of hope for these patients. There's been a lot of energy and momentum with new treatments in this field, such as FDA-approved psychedelic medicine. There are a number of treatments now in phase 2 and phase 3 trials, and a lot of momentum right now that indicates that there may be some approvals right around the corner in the next 12 to 24 months. But with that, there's an entirely new care paradigm. So psychiatric care is going to go from chronic daily medication to episodic interventional care. And so we have to ask ourselves, how do we balance access and safety? How is all of this going to be paid for? What sort of continuing evidence is needed? So due to our experience in this field, we're playing a leading role in preparing the field for all these upcoming approvals here at Osmind. So working closely with the government, biopharma companies, payers, obviously healthcare practices to try to design and enact that infrastructure that's needed to support these treatments and help serve the patients who need it the most.
Great. Thank you. Okay. Who wants to jump in?
I will start off by noting, so students who get services through the K-12 school district immediately do not have access to the route of going to a private psychologist and getting services. And so by nature, the students that we're working with tend to come from very low income populations. In fact, about 80% of our district partners and thus the students that we serve are part of the CDC's vulnerability index, either high or very high needs. The data really speaks for itself when it comes to parallel. As I mentioned prior, 90% of students are citing exceptional progress with working with their specific providers, and 86% are actually reporting back that they are really enjoying the time and feeling their own personal progress with providers, which if you think about a bunch of angsty teenagers, that actually means a lot, right? The nice segue into, as we think about the future and what we're most excited about, obviously continuing to scale our district footprint and our partnerships with, we already are working with 450 schools across 26 states, tens of thousands of students each year. But being able to also think about other new ways to serve those same student population. So right now we are doing very intensive one-on-one care and small group sessions. We are starting to develop new service lines to really double down on earlier intervention with students, knowing and recognizing that we can make a much bigger impact. We're able to get in earlier with students. And so we have some very exciting new service lines in the works.
Great. Thank you. Thank you, Diana. So who else?
I can go next.
Yep.
Oh, sorry.
Okay.
Kazu, go for it.
Oh, yeah. Thank you so much. So at Universal Brain, we focus first on treatment-seeking depressive patients. And our team has published more than 400 papers showing the reliability of our biomarker in psychiatry, and mainly in depression. And our platform is being deployed across TMS clinic, esketamine clinic, and psychiatric hospital in the US. In these settings, our system help monitor patient's brain function and identify who will respond to TMS, antidepressant, and so on. And beyond depression, our biomarker can be applied to anxiety, OCD, PTSD, and building foundation for universal brain-based framework for behavioral health. So over the next year, now our status is 510K pending. So getting 510K is one of the most important milestones for us. And then commercial launch in the US and integration with major TMS esketamine clinic. And we will establish universal brain as a new standard for precision psychiatry and transforming how the world measure and treat mental health. Thank you.
Great, thanks. Patrick?
Awesome, thanks. We built some things from day one to be for a Medicaid population. So it's been in our DNA from the beginning. We've since expanded to work with states as well. So that has given us a broader range of lives that were covered. But really the core of our offering was for youth and teens on Medicaid. And when I look at the next phase for us, we are really trying to champion this model of peer support as an effective solution to some of the workforce shortages across the mental health landscape. We need 3 times more child psychiatrists to fill the gap. Only 1/3 of kids are getting care. 50% with a major depressive episode are not getting care. So for us, over the next year, we're focused on continuing to demonstrate that peer support can at scale be a solution for the mental health and support needs of the teen population, specifically focused on the Medicaid population across our next 4 or 5 states. Thanks.
Great. I think we have a couple more who hasn't gone yet.
I'll go.
Thanks, Dana.
Okay. At George, we have 2 missions. One is to disrupt therapy delivery for children, and we're doing that, and we want to do more of it. So we're adding on extra, tech enhancements and more of the parent portal build out. But we are expanding our reach as well. We have 13,500 users at this point. The second mission is so that no child is left behind. Even though we are very inexpensive, we're less than Netflix for multiple users, and it's the same subscription with a parent portal. We have a free model that we'll be launching as well, so that everybody will have access anywhere in the world.
Fantastic. Okay, who are we missing?
I haven't gone yet.
Okay,
here.
Please.
Yeah, so at Quema, we're really focused on keeping healthcare workers safe. It just so happens that naturally, behavioral health is one of the most plagued parts of healthcare that has a lot of violence, right? So we really focus on that emotional well-being of those psychiatric nurses, behavioral health clinicians, crisis counselors, community social workers, really trying to give them that sense of safety where they're giving care. So like, for example, one of our customers, Child Guidance Center, which is one of the bigger behavioral health, children behavioral health networks within Florida, our solution helped them feel safer, more confident. And their staff was more willing to go to different parts of the cities they served and more willing to report incidents that were normally unspoken. So what we've come to determine is that when caregivers feel protected, they can actually focus on healing and being present with their patients.
Great. Do you have anybody else?
I can go. It's Jijo.
Please. Hi, Jijo.
So at Spring Health, our mission is to eliminate every barrier to mental health care. And so we're going to continue to expand that. We're already global, in over 190 countries, 57 languages, which is exciting. But we're going to continue to target more and more folks by leveraging technology as much as we can. So in 2026, I'm really excited to think about how we can get other people into therapy in affordable ways, leveraging things like our AI infrastructure and technology that's backed by human clinicians. And then over the next 12 months, it's going to be interesting. I think you're hearing a lot of people utilize technology and AI for care. But what's missing in the world is this idea of how do you know this thing is effective? How do you know it's safe? How do you know it's actually effective? So what we also did, and we started this month, is to start we're the founding members of a standard that we're putting out there, an AI mental health safety standard that almost every AI engine could utilize and benchmark themselves against. So I'm looking forward to developing this with the industry, with everybody in the market, to really see if we are meeting the bare minimum that we should to ensure there's safety in all of these AI technologies that are being brought to market. So I'm really excited to do that. And then what we're really looking for is additional people in the council which is called FARA MH, to really understand how to build those rubrics and understand how we can apply that to multiple pieces of technology. So really excited to do that.
Fantastic. I think we got everybody, right?
I'm
Nicole?
happy to go
No, we
now.
didn't get Nicole yet. I just
Yes.
saw you. Sorry, Nicole?
Oh, not at all. So for Bright Life Kids, we're really proud to share that we've been, since the beginning, reaching historically underserved communities and those communities that need the care the most. So for more than 70% of the families we serve, they identify as Black, Indigenous, or a person of color. About 60% of our families live in under-resourced areas, according to the Healthy Places Index. And we have about 5% of families from rural counties where, in California, where access to in-person specialty care is either limited or non-existent. Through our virtual offering, we're able to address that need. We're also thrilled to share that families who engage with our coaching, about 88% meet their behavioral goals, 99% report satisfaction. And so these outcomes are telling us that these early intervention services combined with a culturally sensitive evidence-based care model are really making a measurable difference. As we look ahead, in some ways we still think of ourselves in sort of the early stages of the program, launching less than 2 years ago. We're really focused on expanding awareness so that every family in California knows that this free, life-changing support is available to them. Since the beginning, we've also built really deep relationships within the community, a big part of us being part of the behavioral health ecosystem in California. So we've built over 1,600 partnerships with schools, community-based organizations, healthcare systems. So just really about deepening and expanding those partnerships. Really, our goal is very simple but powerful. We want to help as many families in California as possible and across the country. Closing the gap in access, improving outcomes, and really building a model for equitable, scalable care, mental health care for children everywhere.
Going to give you a choice of one of two questions to answer in 30 seconds or less. One is, since I am DJing the Digital Health Hub Awards, if you could think of one song that defines how you hope mental health behavioral health will change, I would go with Sia's Courage to Change. We have to have the courage to change. Or if you don't want to do that, which I understand, the second would be, what we're finding, especially in behavioral health, is that trust is a lot more important than technology. And depending on where you are culturally, or where you are age-wise, or where you are gender-wise, there's a lot of questions about, trust and, my AI companion, especially when it comes to behavioral health. I'm fine to give them my Epic physical records, but I don't necessarily want to confide in it. So answer one or the other in 30 seconds, and I'm just going to point to people, and so we can go down it quickly. So Nicole, I'm going to start with you.
I will not think quickly enough to think of a song, but I will say, when it comes to trust for Bright Life Kids, we listen to our families. So if we get a sense that they have questions about a policy or a service, a lot of questions lately, in particular in California, about how data is being utilized, especially for immigrant families. We just really lead with transparency. We adjust what we do so that families feel comfortable and safe coming through the Bright Life Kids virtual front door and getting the care they need.
Thank you. Guido?
I think for us, I don't know, for song-wise, I don't know, that's actually a good one, but I think for us to really drive change, I think it's going to be, like you said, about trust, but really about personalizing trust to everybody. Like everybody looks at technology and their providers and looks at therapeutic lines a little bit differently. How do we bring that level of customization to each and every person is going to be the key. And I think being able to do that with a blended technology and provider network is going to be the thing that really does help change how we can get people more access and better care.
Great. Ali?
Song's going to be tough for me, but I would say from the trust side, on my perspective, I'll maybe talk more on the provider side. We're seeing more and more collaboration, interdepartmental collaboration, which we didn't normally see before, where clinicians, IT, security, operations are all collaborating for a goal of delivery and improved delivery, serving all of the stakeholders. And that's something that I feel has been changing a lot recently, and we're going to continue to see that change.
Fantastic. Dana?
Okay, I'll answer both questions. We don't collect data. We don't handle that. It's entirely up to the subscriber, and we use white hat technology, which is non-addictive, and a timed user experience with scrubbed language. The second question about song was actually donated to us by multi-Grammy winner Rob Shirelli, who has a children's line, and it's Imaginations by Paper Rainbows. So I don't know if you want to play that, but it'd be a lot of fun.
That's a good one. That is a good one. Patrick?
When I think about trust, I think about building a really thoughtful product experience that's made for your users. And our users are teenagers, and what they've told us is resoundingly clear that they want more genuine human connection. They don't want to talk to an AI. Many of them struggle to engage with traditional clinical methodologies as well. So what I think for trust in our world is just delivering the experience that they're actually looking for when it comes to getting support for their mental health and wellness.
Great. Kazoo?
Yeah, for us, for Universal Brain, introducing objective biomarker, reliable objective marker is really important for trust from patient. Thinking about the world that the patient can understand what their how their brain function changes during treatment, rather than, oh, I'm not feeling good, or I feel a little better than last week. I think we have to create the world that is based on reliable objective marker, and then now we are ready. Yeah.
Fantastic. Diana?
I would say for us, it's been our primary focus is finding that perfect balance between we have a network of 400 plus clinicians and giving them tools to do their job in more efficient and more effective ways using AI, while still instilling the trust of having a clinical mind behind every decision made, especially that face-to-face time and the suggestions being made to individual students and their parents and ultimately the clinicians that are going to support them. We have built a number of tools. I would say 70% of our proprietary platform is AI tools for providers, but they are really meant to aid the time spent in delivering care to each of these students, recognizing that these providers have dozens of students that they're trying to see at one time, and also help push them to deliver the most effective care, recognizing that they also don't have a ton of extra time in the day to deliver personalized care, given all of those students. In terms of your song choice, I don't have a specific song, but I think you should just play the new Taylor Swift album just over and over again.
Well, there's actually, at the end, I'll give you a song I do play around about that from Taylor. Well, I'll wait for you guys first. Usha?
Hi, yep. Yeah, it's Lucia. Yeah, so from a trust perspective, I think even at like the broader company and governance level, something that's been really important for us is being a public benefit corporation. So we elected for that to really show that we are aligned with our public benefit, which is to maximize patient access to novel treatments. And that level of accountability, even at the board level with governance and then to our employees, has helped to make sure that our North Star is aligned. And even if that means tough choices and trade-offs, that we're always trying to do right by the patient and right by our clinicians as well.
Great. Stephen?
Yes. To start with the song, I think the song should be "Don't Stop Believin'" by Journey. Just thinking about this panel today, there have been so many people that have talked about what innovative solutions they've developed, and just about a decade ago, it wasn't the case. Like there were many, like just initial companies getting started, and I just think if you were to look back in time and look where you are today, just see how much progress we've made. My guess is in the future, there's going to be even more progress. So people that are needing the help need to keep believing, because I think the future is super bright. When it comes to trust, we look at our AI strategy in terms of 3 phases. First, how do you unlock resources to invest more into personalized care? 2, then how do you enable providers to then have enough time to personalize treatment? And then 3rd, once you've done that, how do you ensure that your providers can have assistance to then go and scale their care in a really personalized manner? So it's really about how do you unlock resources for individuals that need while securing all the data within our own, proprietary infrastructure. So that's how we view, our AI strategy and how ultimately we think about building trust with our members.
Great, thanks. Shaja, bring us home.
Yes, hi. So I'm going to start with a song. So the song I think should be Dancing Queen by ABBA, because every mom is a dancing queen. That's why. And we focus on postpartum depression. And for trust, there are 2 aspects of trust. One is for moms or patient here, and then providers. For provider one, we have gone through FDA and taken that pathway. So that had instantly created a trust from a provider organization or OBGYN. We also have published evidence. So those 2 things were very important. As part of being FDA approval, we have to get penetration testing, encryption, safety, and whatnot. So it becomes really important, and we provide that information to provider.
I just want to say thank you to Stephen, Solome, all of you finalists. Congratulations. Thank you for being on this call. The judges are going to watch it. We're going to have it on the website. Mark your calendars for October 20th, where we crown the winners live across 4 stages at Health in Las Vegas. And don't forget to join us afterwards at Chica in the Venetian from 6 to 9 p.m. where we toast to the winners and celebrate with the entire digital health community. The agenda with an add to calendar is on our website. It's under the grand finale agenda under 2025. So thank you again. Thank you, everybody. Have a great day.